There's no way to sugarcoat it that we are facing a liver health crisis. Premature deaths from liver disease have more than doubled in the last 20 years here in Wales. The vast majority of people with liver disease find out when they're in an emergency setting in a hospital, and sometimes that's when very little or nothing can be done. So what we're doing is trying to raise awareness much earlier so that people can take preventative action to stop them ending up in that position.
Mae'n gyfrwng fawr. Mae nifer fawr o pobl yn yfed gormod, ond yn credu'r problemau mwyaf sy'n creu problemau i Cymru yn y dyfodol nawr fydd ordewder, ymysg oedolion a phlant. Does dim llawer o bobl dal yn deall beth yw clefyd yr afu, beth yw cirrhosis a beth sy'n achosi fe, a mae hwnna'n pryder enfawr i ni fel clinigion ac i'r pobl sy'n mynd trwy'r broses fyd.
Liver disease, it can be a horrible disease, but 90% of liver disease is preventable. It's a real shame that people are becoming so unwell. So we try to raise awareness of liver disease, both in the public generally, but also working with health professionals, working on prevention and early detection. It's a massive job, but it's really going to make an awful lot of difference to a lot of people.
Earlier this year in January, we ran a Love Your Liver Awareness Month campaign in Wales, and over 13,000 people took our online liver health screener. Those people not only got access to identifying some of the risk factors, but also some of the things they could do to make some changes. That's also been replicated in the support groups where we've been inundated with new registrations. Obviously, again, these used to be face-to-face, and then with the advent of COVID, we were agile enough to be able to put them all online relatively quickly, and people have just got access to more and higher quality peer support.
I would say that the British Liver Trust is really a godsend, because I remember in, was it 2017, I was diagnosed with hepatic encephalopathy. Instead of just, going on the web as I did at that time, I looked at on the Liver Trust of the site there, and the information, the way they put it was so clear. Then I went on to meet other people that had had this condition and how they'd cope. So it was a great support process as well, really, that I gained from it. And that's where the Liver Trust really came into its own. It was like a bridge between the medical and the emotional needs, and it really filled that need for me at that time. So I've really, really been thankful to them for the information and the help that I've gained from them.
Mae rôl y British Liver Trust yn hynod o bwysig, a maen nhw wedi gwneud gwaith anghygoel dros y flynyddoedd yn y gorffennol. Maen nhw nid jest yn ceisio siarad lan dros cleifion, maen nhw'n siarad lan ar rhan ni, fel meddygon, maen nhw'n gweithio'n gyfagos iawn efo ni, ac yn credu efo'n gilydd, dyn ni'n gallu fod yn pŵer anghygoel o rhan lobio, o rhan mynd at y Llywodraeth yn dweud mae'n rhaid i pethau newid. Gyda'n gilydd yn credu gallwn ni falle rhoi llawer mwy o gwasanaethau yn y gymuned i'r cleifion. Fi'n hynod o ddiolchgar o'r British Liver Trust a fi'n balch o gallu fod yn rhan o ni.
We absolutely feel like we're making a difference. I mean, we don't sort of solicit comments from patients, but they tell us all the time. We can actually sort of see that the difference that we're making. We know that people are getting real support of ourselves and of their peers, and it's just magic when it happens.
We've got a lot of plans moving forward. We're definitely going to be extending the support groups, and already we've made a lot of headway into improving pathways and understanding and knowledge, and people are starting to talk about liver, starting to realise it's not just about heart and diabetes, and we're leading the way in making people aware of how to avoid liver disease in the first place. We're showing the rest of the UK how to do it.